Hello, and welcome. Today we're delving into a complex and often challenging disease of bile duct cancer, also known as cholangiocarcinoma. This is a cancer that originates in the bile ducts, the vital tubes responsible for transporting bile from the liver to the gallbladder and small intestine, aiding in digestion. Understanding this disease is crucial for early detection and effective management. So, what causes bile duct cancer? The precise etiology remains somewhat unclear, but several risk factors have been identified. Chronic inflammation of the bile ducts, often due to conditions like primary sclerosing cholangitis, is a major contributor. Other potential causes include parasitic infections, particularly liver flukes common in Southeast Asia, genetic factors, exposure to certain toxins such as thorotrast, and pre-existing liver diseases like cirrhosis, can also increase the risk. In many cases, however, the specific cause remains unknown. Let's explore the pathophysiology of cholangiocarcinoma. The cancer develops when cells lining the bile ducts undergo genetic mutations. These mutations lead to uncontrolled cell growth and proliferation, forming a tumor. As the tumor grows, it can obstruct the bile ducts, leading to a backup of bile in the liver and bloodstream. This obstruction can cause jaundice, the yellowing of the skin and eyes. The tumor can also invade surrounding tissues, including the liver, blood vessels, and lymph nodes, potentially spreading to other parts of the body. Now, let's look at the epidemiology. Cholangiocarcinoma is a relatively rare cancer, with varying incidence rates worldwide. It's more prevalent in Southeast Asia, due to the higher incidence of liver fluke infections. Generally, it's more common in older adults, typically diagnosed between the ages of 50 and 70. While rare, its incidence has been slowly increasing in some parts of the world, suggesting a possible role for environmental factors or changes in diagnostic practices. Recognizing the signs and symptoms is critical for early diagnosis. Unfortunately, cholangiocarcinoma often presents with vague symptoms in its early stages. As the disease progresses, jaundice is a prominent symptom. Other symptoms may include abdominal pain, weight loss, itching, dark urine, and pale stools. Fatigue, fever, and loss of appetite can also occur. If you experience any of these symptoms persistently, it's essential to consult with your doctor promptly. Diagnosing bile duct cancer involves a multi-faceted approach. Imaging techniques such as CT scans, MRIs, and ultrasounds are used to visualize the bile ducts and identify any abnormalities. Endoscopic retrograde cholangiopancreatography, or ERCP, allows doctors to directly examine the bile ducts using a thin, flexible tube with a camera. A biopsy, where a small tissue sample is taken for microscopic examination, is crucial to confirm the diagnosis and determine the specific type of cancer. Cholangiocarcinoma is often classified based on its location within the bile ducts. Intrahepatic cholangiocarcinoma originates within the liver itself. Periolar cholangiocarcinoma, also known as Klatskin tumors, develops at the junction where the left and right hepatic ducts meet. Distal cholangiocarcinoma occurs in the bile duct closer to the small intestine. These classifications influence treatment strategies and prognosis. Treatment and management of cholangiocarcinoma depend on the stage of the cancer, its location, and the patient's overall health. Surgery to remove the tumor is the primary treatment option, but it's only feasible if the cancer is localized and hasn't spread. If surgery isn't possible, other treatments include chemotherapy, radiation therapy, and targeted therapies. Palliative care focuses on relieving symptoms and improving the patient's quality of life. Liver transplantation may be an option in select cases of early-stage intrahepatic cholangiocarcinoma. Unfortunately, there's no guaranteed way to prevent bile duct cancer. However, certain measures can reduce your risk. Preventing liver fluke infections through proper food handling and hygiene is crucial in endemic areas. Maintaining a healthy weight, avoiding excessive alcohol consumption, and managing underlying liver diseases can also help. Regular check-ups and screenings may be recommended for individuals at high risk, such as those with primary sclerosing cholangitis. The prognosis for bile duct cancer varies significantly depending on the stage at diagnosis and the effectiveness of treatment. Early detection and surgical resection offer the best chance for long-term survival. Recent research is focused on developing more effective targeted therapies and immunotherapies to improve outcomes. Advancements in imaging techniques are also aiding in earlier diagnosis. Clinical trials are exploring novel treatment approaches to combat this challenging disease. While the journey can be difficult, ongoing research offers hope for improved outcomes in the future.